Let me just stop here. So the first order neuron is going to terminate, it's going to get into your spinal cord, right? And that information is going to travel all the way up to the medulla. Okay? In the medulla, you see here that there is the information. The second order neuron starts here. It's going to have the cell body in this nucleus, and it's going to cross to the other side and travel all the way up to the thalamus. So the information travels to the other side here in the medulla. And from here in the thalamus, you see that the information travels a short distance from here from the thalamus to the primary somatosensory cortex. This is our third order neuron, right? So we have the three neurons there. The first neuron is going to receive the information from the periphery. It's going to stay on the same side until it reaches the medulla, right? Here is the medulla, it crosses to the other side, and this is what is called, when it crosses, it forms this medial lemniscus, and that's why this is called the dorsal column medial lemniscal pathway. And then it goes all the way and terminates here in the thalamus, and then the third order neuron have the cell bodies here in the thalamus and terminate in the primary somatosensory cortex. Did you get this? Yes? Alright, so dorsal column, medial lemniscal pathway, 2-point discrimination, vibration, conscious proprioception. Okay? Any questions regarding this? No? Do you know what decusation means? Crossing, like crosses the midline. So if I ask you, at which point the dorsal column, medial lemniscal pathway decussates? So decusation, that's crossing the midline, right? Cross the midline, right? Yeah, it goes from one side to the contralateral side. So if I ask you, at which point in your CNS the dorsal column, medial lemniscal pathway decussates, what's your response? The medulla oblongata, right? Yes? So this is the dorsal column, medial lemniscal pathway. The information that they carry, 2-point discrimination, vibration, conscious proprioception. Okay? Yes? So let's say if I have a stroke in this area of where like I'm painting, right? This is the middle cerebral artery. Okay? I have a stroke here in this area. I'm going to lose sensation if if let's say the dorsal column, medial lemniscal pathway is compromised. Where am I going to feel? Where am I going to lose sensation to vibration or conscious proprioception? On which side, left or right? Right? This is right, and this is left. Remember that always you're always looking at things from that perspective, and here you have the eyesight. This is this person looking at you. Right? So if this is the right, the information is gonna be lost, right? So the fishes is gonna be on the other side. Correct? On the left. Alright. Very good. So there is, I don't know, this is very confusing, and I'm sorry, this slide is horrible. But this just summarizes the other pathway that I really want to talk to you about. Okay? So we're going to talk about the spinothalamic tract. What is this spinothalamic tract? This is the other important tract that you need to know about the somatosensory system. This spinothalamic tract has actually two portions. It has what is called the lateral and anterior. The lateral spinothalamic tract is the one that we're seeing here, right? Where the fibers cross to the other side, right? And here through the lateral, the information that is perceived, pain and temperature. Okay? And through the anterior, we have the light touch, and pressure. Okay? So we're going to, this spinal kilometer is a lateral that carries pain and temperature, and an anterior that carries light touch and pressure. This information, as you can see it here, this is carried by the anterolateral system. Okay? What is different in this system compared to the dorsal column medial and distal pathway is that, let's say if I am feeling here, let's say if I'm burning here my finger, right? There's light, there's fire here. The information, as you can see here, terminates in the spinal cord and it immediately crosses to the other side. It doesn't go all the way up to the medulla to actually decussate. So the decussation occurs at the same level at which the information enters. So big difference. So decussation occurs here directly in the spinal cord. Okay, that's very important. And as you can see here, there is a first order neuron terminates here in the dorsal horn. Remember that in the spinal cord, the dorsal component is the one associated with somatosensory formation, right? So it terminates there. Then it crosses immediately to the other side and go and travel all the way up to the thalamus. And here from the thalamus, it travels to the primary somatosensory cortex where the third order neuron is, right? Does this make sense? Yes? All right, so you have to know those two pathways. I'm not going to talk about the spinocerebellar pathway because it's going to make your life more confusing, but I'm just going to mention that the spinocerebellar, that's the other ascending tract, it says that the information that they carry is unconscious proprioception. Okay? All right, more about pain. You want to have more pain? No? So, I like pain, it's my favorite topic. Yeah, I'm not, what's the name of the great guy? What's his name? Come on, Gary, you know that. What's his name? Christian, yeah, all right. I like pain because I actually spent 4 years of my life doing research on neuropathic pain on patients that suffer neuropathic pain after spinal cord injury. So it's not that I'm a Christian. I just want to clarify that. All right. So basically, don't forget, I already mentioned this to you, that pain is modulated also because there is information that travels to your limbic system. Okay? Don't forget that. And where in the limbic system that information goes? The cingulate gyrus. That's all you have to know. Okay? All right, so let's talk a little bit about the receptive fields and the sensory acuity. Right? Basically, here is where we're going to talk about the two-point discrimination. I want to let you know that there are different areas in your body, and I want you to remember the homunculus distribution. You remember that there were areas of your body that were exaggerated. You remember the hands. You remember the face. They were exaggerated when comparing it to, let's say, your lower extremities or your back or other areas of your body, right? That is just because we had a lot more receptors in those specific areas. Remember that you need some kind of you have better discrimination on these areas, right? So, the more receptors you have in an area, the better, the more acuity you're going to have, right? So, we have what is called this two-point touch threshold or two-point discrimination, which is what's the name of the pathway that carries this information? Dorsal column, medial and distal pathway, right? What are the other sensations that are carried by the dorsal column, medial and distal pathway? What? Vibration and conscious. Don't forget that it's conscious proprioception. Unconscious proprioception is carried by another tract, which is called the spinocerebellar tract. All right. So basically, and that's, let me just show you this table here. basically how you test or how you actually look at this information. So you can actually do it on yourself. You just need a volunteer that is going to sit in front of you with their eye closed, and you can actually do it with, like, I just grab and click in my office. You just need something like this. There's a tool called Calibrate that is more accurate, but you can actually use something like this. If you look at this table, for example, if I go and I have, let's see, it's not in there, but for example, the lips, right? I think that there are so many receptors, like events in that area, and if I'm not wrong, your lips, if you actually stimulate with, let's say, 2 points at the same time, at a 1 millimeter distance, you should be able to feel 2 points, right? If, let's say, for example, I'm going to do the big toe, right? It says 10 millimeters. So that means that if I grab this instrument and I have a patient in front of me, I ask them to close their eyes, and I stimulate the big toe with the 2 points at the same time, right? At a distance smaller than 10 millimeters, or if I do it at 10 millimeters, or if I do it at 7 millimeters, right? Like, what do you think? At 10 millimeters, I should be able to feel 2 points, right? If I do it, what do you think is going to happen if I do it at 20 millimeters? You're gonna feel 2 points, right? So that's the minimum distance. If I do it at 5 millimeters, and the big toe, they're just gonna feel it as 1, right? So if you do it at 10 millimeters, the 2 points, and they feel it as 1 point, there is something wrong there, right? Yes? And you can associate it with the problem probably in your dorsal column pathway. Right? That's all you have to know about these 2-point discrimination. All right. So there is another thing called lateral inhibition, and basically you're going to see that the receptors that are strongly stimulated, as you can see here, like for example, you see this area of the skin. This area is strongly stimulated, right? These are going to inhibit the sensations here on the side, right? So in a way, by inhibiting the receptors here, or the ones that receive less pressure, you're in a way sharpening the perception of that signal. Okay? Oh, that's it. That was fast. All right, let's do this question. There's just a couple, and they're not going to be in your exam, so take all the pictures you want. All right, so what is the term for perception of position and body? This is something that anybody can answer, right? Proprioception, correct? Next. Think a little bit. You have to choose. D? What about A? No? Yes? No? So the majority says what? D as in boy? Very good. All right. Which receptors detect painful stimuli, and where do they send that information? This is extremely easy. So first of all, you can eliminate CMD immediately, right? If you're smart. Because we're talking about pain. So it has to be, it's related to nociception. Have we talked about parietal tract? No, so this is a stupid question. But since it's a painful stimulus, so again, which is the tract that carries painful information, pain and temperature? Which is spinal thalamic tract? Lateral or anterior? Lateral spinal thalamic tract, right? So that's the only valid answer, correct? Yes? You all agree? And I guess that's it. Again,